Hi, I'm Sarah, and this is Baby Spark with the answers you've been looking for. So today's topic is, why am I so sad? Okay, I'm going to specifically address after the baby comes, but sometimes this can happen during the pregnancy as well. So first and foremost, over 80% of women experience something called baby blues. So it's where you go home after you have the baby and you're just a little sad. Maybe you watch a commercial and you're like, I don't know why I'm crying at this commercial. Kind of like hormonal, kind of like PMSy, okay? It's just that after the baby comes out, the hormones take a little bit to even out, all right? Very normal, not a big thing, okay? Just don't be surprised. Postpartum depression, though, is where it's more than just a little bit of sadness, okay? There's also something called postpartum anxiety that does not really get touched on, but is actually more frequent than postpartum depression. All right, but we're going to start with postpartum depression, okay? So what happens is when you go home after you have the baby, a lot of times you can fall to where your hormones, they don't even out the right way, okay? This can happen right when you get home. It can happen a week later. It can happen 3 months later, okay? So if you notice any of these signs or symptoms, or dads or family members, if you notice these symptoms, okay? If mom is very sad, crying a lot, it can get to the point where she can't get out of bed. She's not motivated to take care of herself or the baby, okay? Mom, where maybe you don't feel close to the baby. You don't feel like the baby loves you. You might feel like you shouldn't have had a baby. You're not good at this, okay? Just know these thoughts occur, all right? It's somewhat common. And you might wonder, why am I sad? I'm supposed to be happy. I just had a baby. This is supposed to be one of the happiest times of my life. That's from a commercial. It's not necessarily true. Some lucky people get that beautiful little glimmer, everything's perfect. But more common than not is you go home, it's overwhelming, the baby doesn't sleep, you're tired, you're not eating right, and your hormones are heightened. So if you're not getting enough sleep, if you're not getting the right nutrition, drinking enough water, those things, you are at risk for postpartum depression. You're also heightened risk for it if you have any history of postpartum depression, maybe as a teenager, or things that you went through growing up. If you know that already, then just prepare yourself that, it's pretty possible that you might deal with some of those types of struggles after you have the baby. And also remember, it's not uncommon, okay? These are the things not everybody talks about because they're embarrassed about. But just know you're not alone, and it happens to other people. My point, though, is that if you get to that point where you're so sad, you're in bed, you can't get out of bed, you can't take care of yourself, you're not motivated to take care of the baby, it can get so bad that a mom can have thoughts of harming herself or harming her baby, okay? That's severe. But any of those other things, other than just a little bit of sadness, you need to call your doctor about. You need to be seen. There's things that they can do to help you, even just counseling. But just know it's pretty common, and honestly, with some small interventions, most people can just get through it. You need support, family, friends, and the biggest thing, don't keep it to yourself. Share it with the people around you, okay? Especially your doctor. Postpartum anxiety, like I said, is something that not everyone talks about. It actually happened with my second baby. I had him, he was colicky, he cried a lot. We'll get into that when we talk about colic. But randomly, I'd never really struggled with this ever in my life, in my past, but I would get these panicky feelings, and they didn't connect to real life that was going on around me. I would be shopping in the supermarket, and all of a sudden my heart would start to race, like I would break out in sweat, and kind of that fight or flight response, where you feel like there's something wrong and you have to do something to fix it, but nothing was wrong. And I knew in my head everything was fine. So it was kind of like a panic attack type of thing. And honestly, it never happened to me prior to my pregnancy. And after my son, and after I figured everything out, it never happened again. So it was probably a couple months, though, with my second baby, that I was having those anxiety responses, and they really weren't related to anything situational. It was just specifically the hormones. So that's the main point that I like to make with the moms, is that it's your hormones. It's not you. It's not your past. Get rid of the stigma. It is just a chemical imbalance, kind of like diabetes. The chemicals just sometimes need help being balanced. So, short, succinct spark of a video. There we go. Postpartum depression, postpartum anxiety. Just know it's normal and you're not alone.